Alberta Primetime with Michael Higgins.
Welcome to Alberta Primetime. Ahead tonight, our politics panel on a 23% increase in the budget for the Premier's office. But first, responding to the resurgence of measles.
Absolutely. I do endorse it. So we're doing it, giving information out as much as possible.
The health minister now endorsing the measles vaccine as cases of the infectious disease continue to be identified in Alberta, a province where the latest data shows just 69% of 2-year-olds were fully vaccinated in 2023, and some regions even below 50%. Joining us now, Dr. Craig Jenne, a professor in the Department of Microbiology, Immunology and Infectious Diseases at the University of Calgary. Dr. Jenne, good to see you, sir. Welcome back.
Glad to be with you.
All right. Measles cases now showing up in a number of areas of Alberta. Provincial officials continuing to update exposure warnings. What's your read on why we have this sudden resurgence when it's been off the radar for so long?
Yeah, unfortunately, I think we've been anticipating this coming. We've seen over the past several years, to really almost a decade now, of declining vaccination rates. And measles, being one of the most infectious diseases out there, takes advantage of those numbers. Just for reference, we need more than 90% of the population, closer to 95% vaccinated for herd immunity. And as we've seen, the numbers are nowhere near those levels in the province of Alberta.
Some of us of a certain age certainly have memories of measles way back when. But what is this illness? What makes it so highly contagious?
Yes, this is a viral illness. This is a respiratory virus. It's spread through the air. And because it is so infectious, this spreads widely. There's a lot of evidence saying that somebody can go into a shop or store and even an hour later or more, the air still contains virions or viral particles that can infect an unvaccinated person. So this is something that once it arrives becomes very, very difficult to contain. And with the recent outbreaks in Europe, Eastern Canada, and the southern U.S., it was really a matter of time before cases arrived in the province. And
it's not just a rash that kids get. The complications can be considerable, yes?
Yeah, absolutely. We do see, unfortunately, a high percentage of kids often requiring hospitalization, some requiring breathing support in the intensive care unit. And as we'd seen in Ontario in this current outbreak, starting last year, they lost a child under the age of 5. And in the southern U.S., since the new year, has lost 1 child and 1 adult. So it is a disease that can be fatal to some people.
And in terms of being contagious, how many people can one person potentially infect, depending on exposure?
Yeah, so this could be, each person can infect dozens. It really depends on the exposure. It depends on the individuals in their vicinity. Are they vaccinated, partly vaccinated, fully vaccinated? It has a dramatic effect on how well this virus spreads and how easy it is for us to contain it.
We heard the clip of Health Minister LaGrange off the top. How important is it for the Health Minister to now encourage Albertans to get vaccinated? Because it was just last week, Adriana LaGrange stopped short of recommending immunization, saying it's up to parents to decide.
Yeah, I think this is, something that we really need to see better advocacy for. In the past, this had always been the job or one of the roles of your family doctor. When you brought kids in for their annual checkup, you would get reminded about vaccines and whether the children were receiving vaccines on time. When we look at the numbers, there's a substantial proportion of Albertans do not have a family doctor anymore. And having discontinuous care at walk-in clinics or presenting at emergency rooms really doesn't give your doctor a chance to talk to you about these other questions. So with the lack of advocacy there, we really do need to see better advocacy. We need to see that information, not just where you can go look it up, but actively presented to parents and to people so that they know the importance of vaccination, but also how to get vaccinated.
So whose shoulders then should that rest on? Is that the medical community? Is that our politicians?
I think, there's plenty of work to go around. I think it is important to encourage Albertans, if they have questions, if they do not think they've been vaccinated, for example, can't access their records, to talk to a healthcare provider and determine whether that is the best approach for them and how to get back on schedule. We do know that the measles vaccine, for example, in Canada has been used for decades. It is highly effective, and it is very safe. And it is the vaccine that really for the last several decades has eradicated measles from Canada. And with declining vaccine rates, unfortunately, that disease of the past is back.
If you don't know your immunization records, maybe you don't have access to it. Is it okay to go out and get vaccinated again? Maybe.
So it is safe to receive another vaccine, although this is again a conversation for you and a personal healthcare provider, because each person has a different medical history. In some cases, it may be advisable to check antibody levels in your blood, so a quick blood test to determine whether you do have memory to measles. And if not, it is safe to receive an additional dose of the vaccine if there are questions about whether you're fully vaccinated or not.
Okay, early days, but what could this potentially grow to? How worrisome a development is this for our province, where the entirety of Alberta's healthcare system is concerned?
So, I look to Ontario, Quebec, New Brunswick. I look to Texas and New Mexico, and both of those outbreaks are now well over 300 patients. The fact that we have 4 separate introductions of the virus as of last night into the province, so in the north, in the Edmonton zone, in Calgary, and in the south zone, means we are now containing 4 different exposure groups. We are concerned. There's no guarantee it is going to spread, and hopefully contact tracing has identified the risks. But the fact that we have 4 separate challenges in the province means we are going to be watching very closely for the next couple of weeks to see, unfortunately, if this takes off or not.
And does it, real quick, does it matter whether these cases are in rural areas or urban areas?
So, it doesn't. It really matters more of what the vaccine status is in that community. What are the potential exposures? So whether you're in an urban area and you self-isolate when you have symptoms and call 811 and get advice that way, it's protective. If you're in a rural area but end up going to large supermarkets or gatherings, it can still spread even in the rural areas. So it really depends on the status and how people respond to once they detect symptoms. And we do encourage people to call 811 rather than present at a medical center.
All right. Well, we'll leave it there. As always, appreciate your time, Dr. Jenne. Thank you kindly, sir.
Anytime. Take care.
Dr. Craig Jenne is an infectious disease expert with the University of Calgary.